Greetings, how are you? This is Kinesiology 236, and this is Chapter 9, and we are talking about the knee joint. All right, so now before I get started with the knee joint, I definitely want to get one point across to you guys. We are rolling right towards the end of the term here, and I do not want you guys to get caught really stuck behind the ball with homework. So please make sure you go ahead and stay on top of your homework and get everything done. So without further ado, let's get going. So the knee joint itself, when you look at it and evaluate the joint, it's the big beefy femur up top, and then you have the tibia down below. The lateral aspect is the fibula, that's the lateral bone, and then you have a patella that sits over top of the knee joint. So when you look at the actual knee joint, you have a weight transfer that happens from a loading of the body down from the femur into the tibia itself. The patella, which is a sesamoid bone as you recall, is used to help redirect the forces of the quadricep. Now this certainly has a true or false question written all over, right? The fibula does not articulate with the femur nor the patella at all. And really, when you look at this, it's a weight transfer and an articulation surface between these two, the femur and the tibia. That's where all the magic happens in the knee joint, with the patella on top, not the fibula. So with that knee joint, the patella sits on top of it, and it has a cartilage surface on the underside. And sometimes, that will get rough through usage. And it gets rough because if you think about what's going on there, you have these two bones stacked on top of each other, that being the femur and the tibia. And there's a weight transfer that happens there, but there's also a force transfer that happens between the quadricep muscles across that sesamoid bone that attach into the tibia that allow for a greater amount of leverage. So as you contract the quadricep group, you actually are, as you're bending the knee and say like a squat, and you're doing knee flexion, as you go ahead and contract to do knee extension when you stand back up, or knee extension on a leg extension, you're contracting those muscles and you're pulling that kneecap into the knee joint itself, and it articulates over that surface, and it gets rough sometimes. And that roughness is called chondromalacia, and you'll hear almost like a clicking popping noise, and that noise is called crepitus. So if somebody comes in, they have maybe a hot set of knees. I was joking to say hot, but they have hot knees, and it's usually accompanied with a clicking kind of sound. That's crepitus, and that's usually that roughness on the underside of the kneecap. But realize that sesamoid bone has a purpose we've talked about before. It allows for a greater angle of pull across the joint itself and gives you greater mechanical advantage. These are good, they're great. You're going to dig into these as you get further into your studies as practitioners. I just want you to realize that these are here, but you're not going to be quizzed upon them. So when you look at the knee joint itself, it's diarthroidal, right? So it has synovial fluid and there's a joint capsule, but it's also classified as a hinge type joint. And what's interesting is that that hinge type joint operates in one plane. In this case, it's primarily sagittal, right? But what's interesting is most sport activities require some type of torque adaptation across the knee joint, across the hips, etc. So it's funny when people say they're going to go strengthen their knees to go skiing in Vail and they do a ton of leg extensions. Well, unless they go, and I know I've said this in class, unless they go straight down the mountain, whoosh, that's not going to be the best course of action. Anytime you ski, and you know this if you've ever skied, you traverse back and forth across the face of the mountain. Well, you traverse back and forth with these long levers on the bottoms of your feet, and you're creating torque across the knee joint. It's the same thing when you throw, you run, you jump, and of course you have to land. When you land and you cut and you pivot, you're creating torque across the knee joint. So oftentimes I guide people to do this type of exercise, standing on one foot with resistance being offered laterally, and really focusing on the second digit of the big toe of the metatarsals. And what you're after on this is, and I'll let this play and I'll replay it a couple times. The person, this fine athlete, is rotating about an axis, and they're articulating the hip joint, and there is some articulation across the ankle and the knee. But what they're doing is they're applying force in a transverse plane, get out of here, in a transverse plane through the band. So that band is offering resistance from the left as this athlete is rotating to the right. But what's interesting is this, it's not the actual femur that's articulating. You're articulating the hip around the head of the femur at the acetabulum. And so what you're really hitting are these deep six muscles for the external rotators on this exercise. And believe me, if you ever do this, you'll feel a ton of work on the lateral aspect of the body. Think back to what we talked about with Q angle, and we'll hit on this a little bit more in the lecture later on. Q angle is when the knee comes inside. You have valgus, or you have vargus, the knee comes out. In this case, I'm in a little bit of vargus. And valgus position is kind of the culprit for most ACL tears. So when you work with your athletes, especially your female athletes, you'll find that you have to work on some of these kind of exercises to work the glutes first in this manner in a transverse plane movement. Then you go ahead and do the heavier sagittal plane movements like squats and leg extensions. The deep six are hugely important, guys. I can't stress that enough, and I've said that 100 times. All right, so let him play out. Nice job. Nice job. I took the slides from the book and I took the pictures from the book and I tried to color codify them for you. And this is a top section, superior view without the femur of the knee joint. You have the articulating surface of the tibia. And what holds this all together, you have the ACL, the anterior cruciate ligament, the posterior cruciate ligament. You have the medial, which you know is on the tibial side, and the fibular, which is on the lateral side of the lower leg. And these are the big four. What I tried to do is actually eliminate some of the other stuff and black out the other stuff that's in here, or white out some of the other stuff. But what I wanted you to see is patellar tendon, so you can orient yourself in this joint, and then also have the other ligaments available to you. But these are the big four, these ACL, PCL, MCL, and LCL. Those are the ones you're going to come across most in your practice. This is another view of that, same thing. Try to remove a bunch of the fluff in here. You have the femur, you have the tibia. You have the lateral side with the fibula. You have the medial side with the tibial, MCL ligament. Posterior, notice how he's in front. And the anterior cruciate ligaments in the back. And the one you're really going to see the most of in your practice will be the ACL. The ACL is the one that gets injured the most. And usually it's from non-contact injuries, oddly enough. So the tibia and the fibula articulate across the tibial shelf. And I know we've talked about this in our other class. When you look at that surface, you have this bit of a articulation that happens in the knee joint, and you know at any given time as you go from knee extension to knee flexion, you have this instantaneous center of rotation. So the actual pivot point that's in this knee joint articulates and kind of glides anterior to posterior. Otherwise, if it didn't, the femur would slide right off the top of the tibial shelf. And what kind of holds it all together and what provides the cushion, but also the articulating surface, is the meniscus. And so you have the medial and lateral semilunar cartilage. And so you have these things that are on the top of one side, on the medial side, or the lateral side. Notice the medial side is a little bit bigger than the lateral side over here. But what I want to get across is semi-lunar as part of their name. Think lunar like the moon. I tried to make this as much of a C as I could to make it match, but I got darn close, but I couldn't get it. But the biggie is medial and lateral semilunar cartilage. This is what the fibula sits on and articulates on, and this is also what wears out in the knee joint, other than the underside of the kneecap. I cut and pasted this one from the web just in case another picture of the ACL and the PCL. And you look at the ACL injuries that are out there, usually it's the most common. Usually it's associated with planting, cutting, and changing direction. In high school, usually ACL injuries have a higher preponderance in females than males, attributed to a greater Q angle because of wider hips, but also attributed to, and many of my peers will anecdotally support me on this, the hormonal differences seen in females at that age and how the hormonal differences vacillate through a monthly cycle. And you have a different elasticity in these joints. Although I have not found any study to support it, and perhaps that'll be my doctoral paper when I get the urge to jump into a doctorate program. But what you normally see are ACL injuries. I keep cruising along here. PCL, not so much. And if there is an injury, it's usually from some kind of contact, not so much from cutting and planting. I also cut and pasted this one out from the internet for you, just so you can kind of see this a little bit better with the ligaments in here, with the medial and lateral collateral ligaments, excuse me. For both of these, when you look at them, realize they're for stabilization on the lateral side and the medial side of the body. So if you think of what happens in Q angle with the femur coming in and the knee meeting in, you're having stress on the medial collateral ligament. Whether it's valgus or vargus, it'll stress one side or the other. With the bursa, I cut and pasted this one from the book as well. This is more for your benefit. Realize there are bursa that surround the knee joint, and they help aid in adding fluid into the joint itself. So if somebody comes in, they might have, say, a hot knee condition, jokingly say that, but it might be some type of itis that might not be a tendonitis. It might be a bursitis. And it could be any one of these bursa, and there's 10 of them in there. But they aid in adding synovial fluid. All right, I left this. It's okay. I'm not going to quiz you on any of this, but it's actually some good brain chum for you to read through. Same thing with this unlocking position. I thought this was a bit confusing to follow along with. With this knee flexion, this is pretty darn good. And just kind of think back to our recreational runner versus sprinter and the amount of knee flexion that you saw between the two, how the sprinters actually came up and kicked themselves in the actual fanny with their heel, and how the recreational runners had their knee or their heels a little bit further down so they had less knee flexion. I also want to point out, it's kind of obscured up here. In this example, this person is doing knee flexion. You can see there's a little bit of a counter movement up here in the hips. And remember, hamstring group, it's a 2-joint muscle, and it's going to affect the pelvis. And that's why this area has to be super strong in doing sprinting activities and other activities, because it has to be nice and strong as a pillar, if you will, for all of these muscles to work against as an athlete. Now with this knee extension, I thought this was an unfair example because the previous one was standing and this one is seated. So I pasted in this one. This is a knee extension standing on one foot. Notice how in here, even though this person's incredibly athletic, you're going to have a little bit of a hip issue and a little bit of compensation in the hip itself. He's kind of slumped down a little bit with some knee flexion here. He's not fully straight as he is extending the right knee. Just a smidge of adaptation. But I thought this was a better representation given the previous person was standing and this person is seated in hip flexion. Keeping in mind that with knee extension, the quadricep group, one of them is a 2-joint muscle. Do you remember which one it was? I'm not going to tell you. You got to remember it. And then you had the vastus group, which were single joint. Maybe that'll help you out. All right, I'm at 13 minutes here. I'm going to try to get a couple more slides. And we'll go ahead and boom, look at knee external rotation, which is represented in this GIF. Then you have internal rotation in this GIF. And this should bring us to muscles, which would be a great place for us to pause. And I'm going to go ahead and start a second video at this point. So hang on, hang on.